The Fellowship of the Great Physician welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Lala and Dr. Richard Jensen, who is also a board-certified acupuncturist, practice independently in North Oaks, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimum health and well-being.
Welcome to House Call. I'm Dr. Gerald Lala.
And I'm Dr. Richard Jensen.
It's great to have you with us in this dimension of House Call. This is Are You Being Poisoned? Session 2. So we therefore must have done Session 1. And we're discussing basically minerals. There are good minerals and bad minerals. The bad minerals being referred to as heavy toxic metals, and minerals, another name for them, are electrolytes. That means there must be some type of electrical charge in them or activity, that they have an electrical activity within our body or electrical activities. And what we're going to do, Dr. Jensen is going to do a very brief overview of those of minerals, and then we're going to continue on with the mineral cadmium, for we've already reviewed a couple of them previously. So Dr. Jensen.
Right. Well, as Dr. Lala mentioned, as we're going on with the minerals, it would be good to give you just a little bit of a review on what that is. Minerals are basically they're solid substances that are taken from the Earth's crust, consisting of either having a positive or negative charge to it, or valence as they call it, as part of their reactivity with other metals. And basically what happens is, because of their increased reactivity, they lend themselves very nicely to helping to spur on the reaction of metabolism within the body. So they're called cofactors, many of them, and they help or are vital to basically over 300 life-sustaining biochemical activities within the body. However, the problem with these are, because they're coming from the Earth's crust, and because of how industry is adding a number of chemicals each day to our environment, we're finding that there's a lot of pollutants in the environment, as well as trace minerals that make it into our minerals, either through plant sources in which say food that is being grown in soil that is too close to smelting plants, or that through acid rain that is carrying these chemicals over the land and then raining down upon there. We find that aluminum has a high amount of content within the surface soil, and therefore it gets absorbed into these chemicals, and absorbed into the plant and part of its constituent parts. So these minerals, being cofactors, they're vitamins derived from natural sources that commonly contain these cofactors and are used in processes that are vital to the body. Now, something to think about is whether some of these vitamins that are used in our body are heat stable or heat labile. And the difference is, if it's heat stable, it withstands heat in its processing and in creating it to go into a bioactive source. And heat labile means that it doesn't withstand that. And as we're talking about minerals, the difference there is that in some cases, when they're packaging minerals in supplements, they'll use heat as part of the process to break things down, to remove them from their constituent other parts that they don't want in the supplement, and to purify it and put it in. But in that process of doing that, they break down the crystalline structures and so forth, and chemical structures that are used to make it more bioavailable, more usable by the body. And so that's what we're looking at, from heat stable to heat labile. And some of these elements that we're looking at are most minerals and vitamins are heat stable, unless of course you're talking about how they're packaged by the harvesting from live places. Heat labile means that it's not heat stable. So a lot of the things that we're looking at, from the B complex vitamins and proteolytic enzymes that help us digest our food, to probiotics that lend themselves to intestinal health, and other cofactors are destroyed by heat in their chemical processes. So getting back to some of these trace minerals that are not necessarily good for us, in fact, many of them are toxic to our body, we're going to continue down that list now with cadmium, and Dr. Lala is going to cover that one for us.
Thank you. In the previous program, we discussed and discovered a lot of new information about toxic metals, their adverse effects on health. We went through aluminium, antimony, and arsenic, and now we're going to look at cadmium. On the atomic chart, its symbol is CD. The sources of cadmium are saltwater fish, shellfish, galvanized pipes, and tobacco smoke. Now, those are the primary ones. And also, the other ones are batteries, people involved in welding, paint pigments, solder, and black tea. Cadmium is a byproduct of iron, zinc, and steel manufacturing, as well as manufacturing and the processing of oil and coal refining, car exhaust, and polluted water and soil. So anytime an animal is eating grains or grasses from a field that has cadmium, it's going to come up in that animal's life cycle. When we eat the animal, it's going to come into our bodies. It's the same thing when we eat seafood such as shellfish, saltwater fish. We can get high levels of cadmium as well. A lot of people would not think about black tea, but the black tea contains high levels of cadmium. Now, cadmium continued. Some of the conditions related to cadmium poisoning are kidney problems, liver disease, lung and prostate cancer, anemia, hypertension, in other words, high blood pressure, nausea, vomiting, emphysema. So see, people who are around the processing of oil and coal or steel or zinc manufacturing, they're going to absorb that chemical. It's going to get into their lungs and predispose them to emphysema, pulmonary edema or fluid on the lungs, fibrosis, diarrhea, joint pain such as fibromyalgia, hyperactivity or attention deficit syndrome. My, oh my, a lot of these kids with those type of problems really had cadmium poisoning. Loss of taste, hypoacidity, in other words, they do not have enough digestive acids or a low pH in their stomach. Loss of teeth, decreased testosterone. So if there's decreased testosterone, there's going to be decreased libido. Proteinuria, meaning that there's protein in the urine. Glucosuria, meaning that there's sugar in the urine. And another common symptom or condition of cadmium poisoning are abdominal cramps. Now, we're not telling you what you should take, but some of the therapeutic suggestions for proven cadmium poisoning. In other words, how do you prove if there's toxic metal poisoning? You prove it through blood testing. You prove it through hair mineral biopsy. That's how you prove it. So therapeutic approaches would be antioxidants, including vitamin C, preferably the ester C form, zinc itself, amino acids, which are proteins, and the avoidance of exposure. And amino acids all contain sulfur, varying levels of sulfur. Some are much higher in sulfur than others, and they act as a chelating agent in that they go out and grab onto or claw onto those toxic metals, and they begin to pull them out of the body through primarily urine and feces. Now we're going to look at another very common one that we hear so much about, and it's lead. And Dr. Jensen is going to take a look at that toxic metals with us.
Thank you, Dr. Lala. And one of the things I wanted to bring about is, in trying to stay away from a lot of these toxicities, one of the paramount things is staying away from an exposure or limiting our exposure. And what we find is with a lot of petroleum products like this, people who are, say, auto mechanics, many times from what I've seen, is they get a lot of exposure to these oil type things and they lose a sense of taste, and they put themselves at risk for a lot of these other conditions that you've talked about. So it's something that we look at, not only what we're exposed to in the environment, but even our professions that can do that. And it would help, a little bit of education would help in saying, oh, it's really important for me to avoid some of these exposures that I get in industry.
I know when I was in high school, I worked in evenings at a automobile repair place, and a lot of oil and petrochemicals around there. And then I worked also for a railroad, a national railroad, and I worked in what they call their tank shop, where they repaired diesel engines. And we did a lot of welding. We're around a lot of galvanized pipes all of the time. And when I became aware of that, when I entered private practice in chiropractic and started to do blood studies and hair biopsy studies, and found out high levels of cadmium and lead and some of these other toxic metals, and it took me years to detoxify my body.
Yeah, and we find that with a lot of people who come in with particular professions and things, with welding and things like that, where they haven't taken precautions.
And now around people in computer manufacturing, they're around all these toxic metals as well. So it can be a white collar. It doesn't have to be a blue collar industry.
Right, the exposure comes through your skin and everything. So let's go on and take a look at lead now. Lead, the sources, of course, you want to avoid, and so this is actually helping you in finding to avoid lead. We're looking at plumbing, lead-lined wine casks may also be a source, mines or mining, lead paint, leaded gasoline, putty may be a source of lead. Foods, some foods that are grown next to some of these refineries or what have you, may be containing higher levels of lead. Canned foods, remember it's canned within a metal. Water fountains can contain lead. Soil, water, dental amalgam, and tobacco smoke. And of course now they're having they have kits for checking out paint in your houses, and particularly if the house is old, that will help detect some of lead sources.
And it's
also.
one thing to find out if you have any lead paint in your house, but it's another to find out if you have any lead in your blood or tissues. And it's kind of interesting. You say, why are people generally in the lower social economic scale sicker? Well, look around at the plants, the manufacturing plants that their homes are so close to. And then you say, well, now we're going to do a lot of manufacturing in Mexico because the labor is cheap. Well, then you go and look around those plants and you see they're growing the fruits and vegetables that they ship back into America for us to eat and then pollute our bodies with. So it's interesting. How about the
comes around, goes around.
Does lead do anything else to our body?
Oh, certainly. There's a whole plethora of conditions. One of the things that we also want to look at is that lead displaces calcium in our body and can have a problem with that. It also can displace oxygen in our body, which leads to a lot of our conditions that we have. Therapeutics for it is avoidance.
Okay.
I'm sorry?
So if a person had excess levels of lead in their body, it would predispose them to osteoporosis,
yes,
to fibromyalgia, to chronic back and joint problems, arthritis.
As well as some of these things like fatigue and anemia and so forth too. So let's take a look at that with conditions. Fatigue, anemia, constipation, anorexia, insomnia, so lack of sleep. Check your lead levels. Diarrhea, nausea, lead line on gums, headaches, dizziness, neuropathy, paresthesia, ataxia. Ataxic gaits, not being able to walk very well. That can be part of how its reaction with your nervous system is taking place. Hyperactivity. How about epileptic seizures? People that have high amounts of lead there. Fever, dehydration, brain and kidney and liver disease, mental retardation, neuritis, colic reactions, where babies just are not, they have all this gastrointestinal stuff going on, so they've got this colic reaction going on. Psychosis, neurosis. So some of your some mental diseases could be caused by this. Loss of muscle strength, can also occur. How about mercury, doctor? We're hearing a lot about mercury in the news.
Mercury is something, but before I get into that, let's talk a moment about some of the therapeutic approaches, natural therapeutic approaches to high levels of lead in your body would, of course, be avoidance, increase phosphorus in your diet, increase calcium, chromium, increasing the vitamins A, D, E, and K, vitamin C, the B complex vitamins, including vitamin B6, folic acid, and B3, and possibly EDA therapy, of which we'll talk about a little bit later. Now on to mercury. The sources of mercury are pigments, cosmetics, pesticides, herbicides, dental amalgams, fabric softeners. Would you believe that? Chlorine bleach. Wow, look at, there's two things that are used heavily in our laundries. Plastic, we're around plastic, you can't avoid plastic. Printer's ink, byproducts of heavy metal smelting, grains treated with fungicides. Now you tell me what grains aren't treated with fungicides today. So they react with what they call sulfur groups in animal and vegetable proteins, which inhibit enzyme activities. And enzymes are like the spark to metabolic activities in our body. They make metabolic activities occur. Well, if mercury is going to inhibit those, and if that animal is exposed and ingesting mercury-containing feeds and grains, that's going to go through his or her system, and when we eat those animal products or ingest vegetables or fruits that have mercury in it, it's going to affect us as well. So some of the common symptoms and conditions of mercury poisoning, mercury sickness, are loss of appetite, gingivitis, inflammation of our gums, increased pain threshold. Pain, what would normally cause me pain would not cause me pain. Skin irritations, hyperactivity, stomatitis, in other words, inflamed tongue, hypertension or high blood pressure, depression. Many of the patients that come to us for metabolic analysis and diagnosis and treatment are because they have depression. Irritability, blushing, fatigue, asthma. Many of our asthmatic patients, they've said, medicine isn't helping me with asthma, I'm going to try chiropractic. And of course, manipulation of the spine is good for asthmatics, as well as we look at their nutritional. We bioidentify the vitamins and minerals in their body, as well as the activities of all their organs, and that tells us, is there something we can add naturally to their diet which will help control their asthma or eliminate it. Allergies, ataxia, metallic taste in the mouth. Metallic taste in the mouth. Increased salivation, convulsions, hallucinations, loss of teeth, tremors, kidney or liver failure. What are some of the possible natural solutions, therapeutic activities or approaches to mercury poisoning? Sulfur-containing amino acids, particularly the amino acids lysine, methionine, vitamin B6, selenium, and possibly EDA therapy. Now we're going to look at nickel, the toxic metal nickel.
Okay, well, toxic metal nickel, of course, that's Ni is the atomic symbol for it. The sources of it are tobacco smoke. Does that let you know how healthy this stuff is for you? Nickel mining and processing. It's found in batteries. Of course, you're supposed to try to keep that out of the environment too by turning in your batteries into this proper recycling areas. Jewelry may contain nickel. Rubber production may contain nickel within its production processes. Ink and dye manufacturing, computer and electronics manufacture are also noted for sources of nickel. The conditions that are related to nickel are hypercholesterolemia. So if you have increased cholesterol, you're thinking, oh, it's just diet, or oh, I should go on this drug and things like that. Well, it could be due to toxic metal levels that are increasing that. So that's why when we talk about looking at a person, you really got to look at the whole person to get the whole idea of how best to help them. Hypoglycemia, so they're having problems with their sugar metabolism. Injury to cerebral arteries. Let's talk about strokes that can be caused by that. Apathy, diarrhea, dermatitis, which is skin inflammation, dyspnea, fever, insomnia, vomiting, eczema, which they talk about that there's no real cure for eczema. Well, we got to tell you, it's one thing is you got to look at the toxic metals that they may have. You also have to look at why it's pushing out all these toxins out through the skin. And so look at how that's working. Nickel can also cause lung cancer. Therapeutics for this is we want diets low in calcium and high in phosphorus, facilitate aluminum absorption, therefore muscle, heart, and bone problems, including osteoporosis. So if we increase calcium, magnesium, and vitamin B6, decrease phosphorus, sugar, and animal proteins, and avoid those things that can cause nickel conditions, protein and sulfur-containing amino acids will help for its detoxification and getting rid of it. And pectin. Pectin is a kind of a fiber, and it helps to move this stuff through, helps clean it out of the gastrointestinal system, and may help you in partly for the avoidance. How about osmium, Dr. Lala?
The toxic metal osmium is found in platinum residues, nickel processing, electrical contacts, fountain pens, instrument pivots, and of course throughout the chemical industry. Osmium dust can cause lung congestion, skin and eye damage. How about palladium?
Palladium is PD. It's also known as fool's gold and can be found in dental amalgams. It's less expensive. Gold amalgam is used in dentistry, where dentists use other heavy metals such as nickel, copper, cobalt, gallium, and silver as part of those amalgams. So palladium, it can cause things such as immune weakness, so it affects your immune system, headaches, loss of teeth. Interesting to put that in the teeth if it can cause loss of teeth. Palsy, bronchitis, weight loss, fatigue, loss of memory, burning tongue, a sensation of a burning tongue, tinnitus, which is ringing in the ears, burning tongue again, swollen lymph glands, excessive salivation, cold mouth, burning eyes, allergies, cardiac arrhythmia, excessive sweating, and muscle, joint, and bone pain can also come from palladium. How about platinum, doctor?
Platinum, wow, that's a good one to talk about. Platinum, the sources, of course, are some of the common ones we're aware of are jewelry alloys, cookware, dental amalgams, electrical plating. Some of the more common conditions related to platinum poisoning are enzyme malfunction, protein malfunction. So there could be a wasting away of muscles, and so we could have like fibromyalgia, brain issues such as Alzheimer's, dementia, or Parkinson's, problems involving the nervous system. Certainly, as doctors of chiropractic, we see many of those issues, heart and liver and kidney issues. So many of the people that we see have already gone the medical route, and they're either saying they can't help them, or they've got liver failure, heart failure, brain failure, kidney failure. And some of these people are astute enough to say, look, I'm not going to allow that to happen to me. I'm going to look to a natural source. Some people run off to a health food store or some nutritionist or homeopath or some chiropractor who doesn't do diagnostic testing, and then they end up with us and they say, you know, we have to take a serious look at this. And so we do diagnostic testing of blood studies and hair mineral biopsies, and we find these chemicals. And so then we know how to desensitize their body and detoxify their bodies of them. So any heavy metal used in jewelry, alloys, or cookwares, what does platinum do? It interferes with the body's use of proteins and predisposes people to enzyme and protein malfunction, affecting our brains, muscles, nervous systems, and our organs. Scandium, widely distributed in many ores. It's highly toxic and carcinogenic to our liver and our bones. Tellurium, it is associated with garlic-like bad breath. It causes a decreased glutathione. Now let's continue with that. Some of the sources of it are coal burning and smelting, computer and electronic manufacturing, It's absorbed by paints or plants into the food chain.
Doctor,
Yes.
excuse me, that's thallium
Thallium? Yes.
rather than tellurium?
Thallium, thank you. Found and combined with bromine, chlorine, fluorine, and iodine. I think some of those things, chlorine and fluorine, are in our water. It remains in water and air for extended periods of time, and it is not easily degraded. What does that mean? It means that it doesn't weaken very easily, as many of these toxic metals don't. So now Dr. Jensen is going to look at thallium.
We're going to continue with thallium with the symptoms of toxicity with that, and we find that it is toxic with the autonomic nervous system. That's the one that tells you to breathe, for your heart to continue beating, for your digestion to occur. It's all those things that you don't have to think about to take place. The autonomic nervous system takes care of. Tachycardia, which is a increased heart rate. Hypertension, which can be created by tachycardia. Numbness in the fingers, numbness in the toes, vomiting, hair loss, diarrhea, dyspnea, birth defects, and liver, heart, and kidney disease. And then let's look at thorium. Dr. Lala?
The sources of thorium are uranium, water, and soil. Many of the common conditions related to thorium poisoning were skin cancer, chronic cough, dyspnea, cancer of the bones, liver, and lungs. It also causes birth defects and infertility. Next one would be uranium.
Uranium, we're looking at the sources are in the rocks, soil, water, plants and animals, fertilized foods, light bulbs, photographic chemicals, household products. Remember I talked about the person who had uranium poisoning? We found it was from the cleaning products they were using. Ceramics. So let's say tile layers, and people who work with tile can have that, or people who do a lot of ceramic work. It's a radioactive chemical, and people who work with phosphate fertilizers or where uranium is processed are at high risk for that. Remember, the effects of radiation are cumulative in the body. Uranium conditions can be lung and skin cancer, can have birth defects, and infertility can be the results of this. So, doctor, where does that put us?
Puts us at looking at some of the natural solutions, which would be vitamin A, vitamins A, D, E, and K, selenium, chelation therapy, when often that involves DMSA or EDTA, and that has to be done by a medical doctor, but there are oral chelation therapies. Certainly we do a lot of oral chelation therapy, and we find it to be effective. EDTA and DMSA is an intravenous approach. And again, the thing is, to see is to know. And there are many issues. A person can shotgun themselves and say, well, I can take care of this problem by doing this or doing that. But again, the only way that you're going to truly rule out or diagnose potential toxic metal poisoning is through blood studies and hair mineral biopsies. Those are the two primary keys. And somebody should be doing that minimally. Even if you're enjoying good, normal, natural health, those tests should be done at least twice a year if you're in natural health. So God bless you. If you need any information, give us a call, send us an email. We're happy to send to you what we have. There are many other toxic metals you should know about.
House Call TV has been brought to you by the Fellowship of the Great Physician. For further information, please call at 651-484-8521 or visit our website at www.housecalltv.org. Until next time, thank you for listening to House Call.